Hi everyone, I'm Dr. Megan Dowling, and thanks for tuning in today to my Healthy Families Facebook Live video series, where I'm dedicated to bringing you important, research-based, unbiased information to help keep you and your families happy and healthy. So today I want to talk about a subject that comes up in my office quite frequently, and that is the subject of prenatal vitamins. Everybody knows that they should take a prenatal vitamin, but a big question that comes up is what to look for in a quality multivitamin. Quality turns out to matter quite a bit for a number of reasons, and I want to talk about at least one of these reasons today. So one thing to look for in a prenatal vitamin is to see if your prenatal contains either active folate or folic acid. And generally, if it's a cheaper prenatal vitamin that you got at CVS or Costco or something, it's going to contain folic acid. All prenatals contain this type of B vitamin because it is known that the lack of folate in the diet in pregnancy can cause neural tube defects such as spina bifida and anencephaly. And this is when the baby's born without a brain. So everybody's told to take their prenatal with folic acid. However, here's the problem. A gene called MTHFR. The MTHFR gene is responsible for making the enzyme that converts folic acid, which is vitamin B9, into the active form of folate, which is what we use in the body to do work. It is estimated that up to 40% of people contain a defect in the MTHFR gene. And if you have this defect in MTHFR, then you can't convert the folic acid into activated folate. So this means that even though you're taking your prenatal vitamin with folic acid, you still might be suffering from a folate deficiency. When women who have the MTHFR defect, when they take synthetic folic acid, they're unable to metabolize it, and the folic acid builds up into their body, which can trigger the growth of precancerous cells and also exacerbate MTHFR-related symptoms like migraines and blood clots. It literally acts like poison for these women. And studies have shown that during pregnancy, women who test positive for the MTHFR gene have higher risks of miscarriages, preeclampsia, and postpartum depression. And babies born to mothers with the MTHFR gene defects also have a higher risk of autism and neural tube defects like spina bifida, and commonly seen lip and tongue ties, which make breastfeeding extremely difficult. So with such a high percentage of people affected by the MTHFR gene defect and the extreme consequences that folate deficiency can have on a developing fetus, it is essential to make sure your prenatal vitamin contains the active form of folate or methylated folate. This is the brand that I like to use in my office, right here by Orthomolecular, and you can see why here if I hold it close enough and it doesn't get blurry, and if you pause this video you can probably find the methylated folate on there. And that is why I like this prenatal a lot, because it contains that active form of folate. So look on the label of your prenatal vitamin and see if it contains folic acid or folate. And if it contains folic acid, throw it in the garbage and go find a better prenatal vitamin. So we all want to provide the best for our babies, and this little detail can make a world of difference. So that's it for this week. I hope you enjoyed today's tip, and I will see you next week for another super interesting Healthy Families topic. Bye now.